A lot of questions come to me, and I try my best to put together in writing some of the best practices that I have experienced based on my own personal experience and observation working with dentists over the course of 20 plus years. And so a lot of dentists struggle with patients that come into their dental practices and they need to have services done. They create a treatment plan within the office, and then off the patient goes without scheduling the appointment. And then the dentist then goes to the front desk and makes them responsible for making sure that the patient comes back for that outstanding treatment. Now, this is the first mistake that I want you guys to be on the lookout for. You should not put the burden onto your dental front desk to convert the patients when the patient leaves the dental chair. If they have had an objection, that is on you as a clinician. And so I want to share with you the 4 reasons why your patients are not coming back, or the 4 forms of objections that I typically see in a dental office. There may be more depending on your industry, but specifically dealing with dental practices, I feel and I've discovered over the years that there are 4 main reasons why patients reject treatment. So let's go over the 4 reasons. The first reason why patients refuse treatment at your dental practice could be pain. Patients have had a traumatic experience prior to coming to your dental practice, and it is up to you to determine if the reason why the patient is not returning for treatment, once you dismiss the patient and you let them go home without rescheduling their appointment, if they're not replying or if you're unable to get in touch with them, could be that the reason why they're not doing it is because they are afraid of the actual physical procedure itself. And so what are some of the things that you can do in this case? Well, one of the things, if you can perceive, and again, during the conversation with the patient, from the initial conversation with the patient over the phone, from the conversation that you've had with the patient in the clinical room, will give you signs about whether or not this is a patient that suffers from anxiety over the dental treatment being perceived as painful. And so the way that you handle this objection is by focusing on the care itself and probably presenting to the patient with other patients that have had similar services performed and how they were able to see the progress and not be traumatized by the experience. So that's one of the first reasons could be pain, and it's a very common one. Dentists have evolved over the years, but our baby boomers and all of these other patients have really had traumatic experiences as children, and they truly hate going to the dentist. And so the second objection that I've come up with over the years has to do with price. A lot of patients really have trouble with services and the associated cost of treatment in the dental practice. And so when a patient comes into your dental office and they need an extensive treatment plan, you are going to know that they have been avoiding getting this treatment and that there may be reasons why they have been postponing getting the care that they need. And as the services or the decay sits in the patient's mouth, the services get bigger and bigger, and the bigger the cavity, the more expensive it is and the more painful that is going to be. And so if you are noticing that the patient, and by having conversations, these are one of the ways in which you are going to figure this out, is by having the conversation with the patient while they're in the chair. And if they tell you things that I need to speak to my husband about it, why does this cost so much? I thought my insurance was going to pay for it. These are all the signs that will tell you they have an issue with the actual price. And if that is the case, then your responsibility and the tool that you're going to use or the way that you're going to handle this patient is by reassuring them that the cost of treatment is going to get worse or more expensive over time if they don't address it now, and that you also have ways in which they can either finance some of the services. You're going to sort of filter and screen the patient for other ways in which, other things in which they are making investments for themselves, and really emphasizing the importance of the care primary to their dental insurance and creating a game plan for them financially. in-house membership programs, their credit or different in-house financing options. All of this information you need to have readily available for your patients in order for you, once you detect this type of objection in your dental practice, so that you have these systems in place readily available in your toolbox to be able to offer to your patient. Now, the third objection that I see in dental practices has to do with trust. And this is a big one. And I feel that a lot of dentists, especially when you're starting out in your practice, you feel like you almost have to start doing treatment same day, or that you have to get them through the insurance, and you're so eager to start generating income that you lose the connection with the patient at a personal level, that it's customized to them rather than the systems that you have in place to maximize the scheduling time, or a patient who didn't show up or had a last minute cancellation and now you're trying to fill that gap. And I've seen a lot of dental offices struggle with overdoing treatment or over emphasizing in doing services rather than taking the patient at their pace. And that hurts the patient retention rate, because the patients feel that I cannot trust this doctor. This doctor is only focused on what my insurance is going to cover and really wants me to get the work done without me consulting it, without me knowing it. I wasn't prepared to come in and have all of these services done at once. And so you have to be very mindful and make sure that you're connecting with the patient, not communicating the treatment plan, but connecting with them so that you filter out and address their objections. Some patients may have more than one objection. Sometimes the patients will have an issue with the pricing, as well as have a traumatic experience in the past, the second objection. They also have a trust issue. And when the trust issue comes into the picture, the way that you handle it is by making sure the patients understand the service and that they understand the value of the work. And you have to ask them questions such as, is this clear to you? Do you really understand why you need this? Do you have any questions for me, to reassure them that what you're proposing as the treatment, it's in their best ultimate benefit? And so that is how you would handle the third objection, which is trust, by making sure you let the patient know I'm here for you and with you throughout this journey to make sure you get into the ultimate oral health you need to be a healthy individual who is proud of their smile and everything else that comes with the importance of having a good relationship with a dentist. So do not take this for granted. You need to build trust with your patients. That is one of the biggest reasons why I see patients not returning back for treatment in dental offices, because the dentist failed to build trust. And then you cannot put the burden onto your front desk to be the miracle worker who is going to go and then just create all these treatment plans in the back in the clinical room, and suddenly all of these patients are going to return back and the front desk has a script and it's going to work a miracle. That's not how it works. You have a very big, important place in the dental practice, and it's ultimately your responsibility to first do the initial conversion or the retention, and that's by building trust with the patients, addressing their concerns and their different objections, which, could vary. I want to talk about the fourth objection that I see in dental practices. So we've gone over pain, we've gone over price, we've gone over trust, and then the other pain would be time. Now, a lot of patients are now busy or running around. They may be a business owner, they may run a corporation, they may have small children, and time is an objection to them. I relate to this personally in a lot of ways. I have 2 small kids, my house duties that I need to address, I have a husband, I have a business, so time is of essence to me. And when I go into any business, I want to make sure that I am treated with the time, with a sense of urgency for certain things. But for your patients, a form of objection could be that they just don't have the time available. So what is the strategy for you to handle this fourth objection? Well, it's simple. Try to replicate the initial visit when they first came in. They came in on a Tuesday at 9 o'clock in the morning. then it may seem as if this is a good time for them and a good date. So you can go ahead and say, well, I noticed that you were here on Tuesday, January 7th and at 9 a.m. and your visit went very well. So I just want to make sure if this day seems to be a good day for you, I can go ahead and replicate it and make sure that, we give you enough time to schedule for any cancellations until you give them the policies and for your practice in terms of cancellations and things of that nature. But really have a game plan and have your toolbox ready to know how to decode the different signs of objections that your patients may bring about before they leave your practice. Now, in another video, I am going to talk about the importance of not scheduling your patients after a pre-authorization. This is a mistake a lot of dental offices make, and I want to address that on another video. So stay tuned for that video. But to recap on today's video, let's talk about the 4 objection reasons from patients in your dental practice and the reasons why they may not be returning back. First one would be pain. They have traumatic incidents and they don't really feel comfortable getting the services done because they think that they're going to be underpaid. The tool and the strategy for this is to make sure that you have other patient testimonials that address a certain the same type of scenario, and walk them through the process and make sure that you tell them that they're going to be numb, that you've done this a lot of times, that you're gentle, that you are going to stop and create a game plan for those patients. Make sure your front desk reinforces how gentle and how caring you are, and how other patients refer to you as someone who is painless free dentistry, right? So that's for the first one. For the second one, which we said is price, you need to make sure you have in-house membership and financial options in place, and that you stress to the patient the worst case scenario, how much it would cost for them to not have the services done, and make sure that you have a payment plan option readily available for them to ease their concern and make them aware that you are here to help them stop the problem where it is now, but it's not going to get cheaper if they keep procrastinating it. That would be your strategy for that. At least that would be the way I would address it in my offices, and this is what I teach my students. The third one would be trust, and this one is totally, no matter how great your front desk person is, and I have seen offices where the dental front desk is amazing, but then the dentist in the back is concerned they're not getting the money that they need to get, and then they go in and they start to overdo services. You need to build trust and take them on their case. It is not their fault that your office is not where it needs to be right now if you're a startup dentist. And at the end of the day, it is your responsibility to make sure that every person that sits in your chair, you get to know them personally and you treat them in a customizable way. There is no cutter, script for all of the patients alike. You need to customize it to their experience and their needs. So building trust is extremely important. Do not just communicate what your findings and the work that you're going to do. Connect. Everyone communicates. People connect. Those that connect are usually the ones that are very successful. So I'm encouraging you to connect with your patient starting immediately. Now, the fourth one is time. And for time, we said replicate the visits as the patients find it useful to them. Make sure that you have availability on the schedule, that you can put them on an ASAP list. You work it out with them, because time at this time, for certain patients is a form of objection. And I just want to make sure I share these different things that I have personally seen in dental offices. I hope again that you find them useful and helpful. And if you do, please do not keep this video a secret. Share it. Make sure you like it. Make sure you subscribe to my channel so that when I do release a new video, giving that I have time because of my busy life with the kids and the husband and the business and the team and everything else. When I do put a video together, I want you to be one of the first ones to get it, because again, my goal is to help every dental office in the world be able to increase profitability, decrease stress, make sure that we build a system where the clinical and the front desk team is feeling like they're growing individually and collectively. Thank you so much for watching. Looking forward to seeing you on a later video.